Hi guys, I first wanted to say I miss you guys all so much. I love my job and totally enjoy seeing everybody every day, so we miss you here. I wanted to record this video to make sure that you guys kind of have some answers to some of the questions that I've been getting. As you guys all know, due to the coronavirus, we are not able to see patients at this time. We are restricted by the ADA and other governing bodies to only see dental emergencies. So with orthodontics, we rarely really have any of those. The only true emergency that we're able to see is really trauma or some sort of issue with an appliance that keeps you from being able to open your mouth or eat. And so that really kind of limits us. So I'm going to give you lots of little helpful hints, and Natalie and I have been busy recording videos on how we can better address some of those concerns that you guys are facing. So if for any reason you are having any trauma or anything like that, please make sure that you contact your general dentist. And I know several oral surgeons that are still open and practicing and handling those emergencies at this time. So broken brackets are really preventable. So the first thing I would suggest to all of you is to make sure that you're really watching those food choices. It's going to be a lot harder because we are at home, and food is readily available to us, and we're probably snacking a lot more. So please make sure that you're really watching those food choices that we reviewed with you, and making sure you're staying away from anything hard, crunchy, sticky, or chewy that can cause brackets to break. If a bracket should happen to break, there's no need to worry, and it wouldn't be considered an emergency, so we would not be able to see you in office to fix it. So there are a couple things. Go ahead and watch the other videos on our YouTube channel that you can do with those broken brackets, such as applying wax over it. At the most, it could be annoying. It might slide side to side or spin around the wire, and what we can do for that is just to reposition it into place and then place wax over it. The next option that we have is to actually remove the colored tie and take the bracket off, making sure that you do put it in a little Ziploc bag for safekeeping and bring it in with you when we're opened again. So that's your second option. So you can have two options, and both videos are included on the site, and I believe they are all put into one. So what to do if there's a broken bracket. Our next question that we're getting is what to do if there's a poking wire. So this is very common and can happen, during regular orthodontic treatment. Normally we would get you in right away to make sure that you're comfortable. In this instance, with the closure, we are not able to do that. So there's a couple things that we can do. You can apply wax over the end where the pokey wire is present, and we've got a video for that. The other option that we have is to try to clip the wire if it's in a spot where wax doesn't stick. Another little trick that I have is to use sugar-free gum if the wax isn't doing the trick. But if neither of those work, my suggestion would be to cut the wire. So what you're gonna wanna do, because likely you won't be able to get as far back as you'd like into the mouth, what you can do is clip it at the furthest most brace closest to where it's poking. So go up a few teeth wherever it's poking, and right in between those two braces where you have better access, go ahead and clip it there. Make sure you do hold on to that wire so that it doesn't move back with the force of a clipper, but you'll use nail clippers. Just please make sure anytime you're doing any of these things that you're really thoroughly washing your hands or wiping the clippers off with alcohol. So make sure everything's nice and safe and sanitary. So clip that wire, and then what you can do is use tweezers to go ahead and carefully remove the wire out the back of the brace. Again, think of that last back brace as a little tube, and the wire just runs inside of that. And if you can get tweezers in there, you should be able to just slide it forward and out of the mouth. If sliding it forward with a little tug doesn't work, you can also push it back and guide it out that way as well. The next question is, what happens if we lose or break our retainer? And this is a very important one. And although it is very important because we do want to maintain those nice, beautiful smiles out there, what we are going to have to do at this point in time, my best solution or remedy for right now is to go to your local Walgreens, your CVS. You can also order online and get a Boil and Bite mouth guard, and I would recommend following instructions there and using that just to maintain and hold the teeth, because that is another appointment that we aren't able to see in the office. It will require a new mold to be made, or possibly even a new scan with our iTero scanner once we are able to reopen. So please, though, contact the office in any of these instances. We are recording everything that's happening and making sure that we can prioritize for when we reopen to get all of you guys back in here to see us. The next question that I'm getting is, what if we had a retainer check, or what if we had an appointment to look at our expander and see how we're doing there? There's kind of a lot of work going on behind the scenes. This is a new, unprecedented time for us. So what we're really in the works getting up and going is virtual appointments, so virtual assessments, and we should be able to cover some of those things when we get that up and going. So please just make sure you're following us on Facebook, following us on Instagram, any of our social media, watching our website. Also, of course, you will be getting a call immediately if you've had one of those quick visits that are usually in and out, easy to do, but we're not able to see you at this time, and would like to try to get you in for a virtual assessment. So the next question that I'm getting is, hey, we're in aligners, what do we do next? So even though we're closed, go ahead and continue on with everything that I've recommended for you as far as your trays go. So continue at the same rate or same speed that you're changing the trays. Also make sure you're wearing the elastics just like we had talked about.